we are going to discuss nutrition assessment. What is nutrition assessment? Nutritional assessment is the systematic process of collecting and interpreting information in order to make decisions about the nature and cause of nutrition related health issues that affect an individual. This assessment involves measuring body weight, height, heart rate, waist circumferences, muscle mass, bone density, and other factors that may affect how much food you need to consume. Based on the data gathered, one can make an informed decision on what a person needs to eat in order to achieve and maintain health. The goal of nutrition assessment is to determine if your diet meets your nutrient requirements, which are based on your age, gender, activity level, current medical conditions, medications, and lifestyle choices. If your diet falls below these requirements, you can make any required changes to improve your eating habit. A nutritional assessment is a practice provided typically by nutritionists or trained healthcare providers that looks at an individual's overall dietary health. Nutritional assessment as part of its comprehensive diagnostic evaluations leading to better treatment outcomes. A nutrient is a substance that provides the body with the nourishment required to be healthy. A nutritional assessment looks at whether the body is receiving the necessary nutrients. A nutritional assessment involves taking anthropometric measurements and looking at medical history, clinical and biochemical characteristics, diet, and other environmental factors such as food security. A nutritional assessment will first and foremost identify if an individual is malnourished. Malnutrition is defined as disturbances of form or function arising from the deficiency or one or more nutrients. Because everyone's body composition is so different, malnutrition can be hard to diagnose, but typically a diagnosis looks at the body mass index. And if 5 to 10% of total body weight has been intentionally lost in the last 3 to 6 months. Symptoms of malnutrition may include low mood, fatigue, muscles weakness, and being prone to infection or illness. Malnutrition is a serious condition that happens when your diet does not contain the right amount of nutrients. It means poor nutrition and can refer to undernutrition and overnutrition. In undernutrition, individual not getting enough nutrients, and in overnutrition, individual getting more nutrients than needed. Common signs of malnutrition include unintentional weight loss, losing 5% to 10% or more of weight over 3 to 6 months is one of the main signs of malnutrition. a low body weight, people with a body mass index under 18.5 are at risk of being malnourished. A lack of interest in eating and drinking, feeling tired all the time, feeling weak, getting ill often, and taking a long time to recover. In children, not growing or not putting on weight at the expected rate. Malnutrition is a common public health problem that affects millions of people. Anyone can become malnourished, but it's more common in people who have a long-term health conditions that affect appetite, weight, and how well nutrients are absorbed by the gut, have these swelling problems, and are socially isolated, have limited mobility or a low income, need extra energy. People who are 65 years and over are particularly at risk, and weight loss is not an inevitable result of old age. Treatment for malnutrition depends on your general health and how severely malnourished you are. The first dietary advice is usually to eat fortified foods that are high in calories and proteins. Snack between meals. Have the drinks that contain lots of calories. Some people also need support with underlying issues such as limited mobility. If a child is malnourished, their family or carers may need advice and support to address the underlying reasons why it happened. If these initial dietary changes are not enough, a doctor, nurse, or dietitian may also suggest you take extra nutrients in the form of nutritional drinks or supplements. If you have difficulty eating and this cannot be managed by making the changes such as eating soft or liquid food, other treatment may be recommended, such as a tube feeding. This can be either passed down your nose into your stomach or inserted directly into your stomach through the skin of the tummy. Nutrition that's given directly into a vein. The best way to prevent malnutrition is to eat a healthy, balanced diet. You need to eat a variety of the main food groups, including plenty of fruits and vegetables, plenty of starchy food such as bread, rice, potatoes, pasta, some milk and dairy foods or non-dairy alternatives, some sources of proteins, meat, fish, eggs, and beans. Steady weight gain is one of the signs that your baby is healthy and feeding well. It's normal for babies to lose some weight in the first few days after birth. Baby will be weighted during their first 2 weeks to make sure they are regaining their birth weight. Most babies are at or above their birth weight by 2 weeks. Health visitors will support you if your baby loses a large amount of weight or does not regain their birth weight by 2 weeks. They will take to you about how feeding is going. Possibly ask to observe a feed if you are breastfeeding and look at your baby's health in general. After the first 2 weeks, your baby should be weighted no more than once a month up to 6 months of age, and no more than once every 2 months from 6 to 12 months of age. no more than once every 3 months over the age of 1. Baby will usually only be weighted more often than this is if you ask for it or if there are concerns about their health or growth. Baby's length may also be measured at some of their developmental reviews. Child's growth will be recorded on centile charts in their personal child health record. These charts shows the pattern of growth healthy children usually follow. They are breastfed or formula fed or having a mixture of both. Boys and girls have different charts because boys tend to be a little heavier and taller, and their growth pattern is slightly different. The curved lines on the charts are called centile lines. These average baby exactly may go on by 2 centile lines. It health visitors who can advise you. It's normal for baby to be on different centiles for weight and length. The are usually similar. Babies are chart will not look exactly the same, even their own brother and sister. Usually baby will gain weight most rapidly in the first 6 to 9 months. Their rate of growth as they become and are more active. If baby or toddler is ill, their weight gain may slow down for a while. It will usually return to normal within 2 to 3 weeks. Child's height after the age of 2 gives some indications of how tall they will be when they grow up. If you like, you can use the adult height predictor in your baby's red book to work it out. Once child gets to the age of 2, a health visitor may use their weight and height to calculate their baby's body mass index and plot it on a centile chart. This is a way of checking whether child's weight is in the healthy range or not. If they are overweight or underweight, a health visitor can give you advice about your child's diet and physical activity level. 5 years old may be small, but they are growing and need the energy and nutrients that come from a varied and balanced diet. If your child is underweight, they may not be getting enough calories. All children need the energy and nutrients that come from a varied and balanced diet. A healthy diet for a young child is not the same as a healthy diet for an adult. Many of the healthier alternatives that adults are advised to eat are not suitable for toddlers and young children. Children have smaller stomachs than adults and need to eat smaller amounts more often. Eating 3 meals a day plus 3 smaller snacks at regular times is typical. If child is underweight, it might be tempting to give them high calories but unhealthy foods such as sweets, chocolates, sugary drinks, cakes and fatty foods and drinks. But a varied, balanced diet is the key to a child's healthy weight gain. A balanced diet for a young child means having a variety of foods that follow Eat Well guide. From the age of 2, a child should begin to eat a diet that is like the rest of their families in line, at least 5 portions of the variety of fruits and vegetables every day. Meals based on starchy carbohydrates, bread, rice, pasta. Some dairy or dairy alternatives. Choose lower fat and lower sugar options. Some beans and pulses, fish, eggs, meat, or other types of proteins. Unsaturated oils and spreads eaten in small amounts. Plenty of fruits. Children, especially those under the age of 2, need the concentrated energy provided by the fat. There are also some vitamins that are only found in fats. This is why energy-dense foods such as whole milk, yogurt, cheese, and oily fish are so important. Once child is 2, you can gradually introduce lower-fat dietary products and cut down on fat in other foods. As long as your child is a good eater and is growing well. By the time child is 5, they should be eating a healthy, low-fat diet like the one recommended for adult. It's not recommended to give your diet for your children's high sugar drinks and food. When sugar touches your child's teeth and for a long period of time, it causes more damage. If your child does have sugary foods or drink, it's best to only give them at meal times to minimize the damage to their teeth. Saturated fats are unhealthy fats, such as the type in burgers, biscuits, cakes, and cheese. Try to not give your child these food often. Whole grain foods include the foods such as wholemeal bread and brown rice, s- which are high in fiber and may make your child feel full before they have taken in the calories and nutrients they need. After the age of 2, you can gradually introduce more whole grain food. Water and plain cow's milks are the best drinks for young children after the age of 12 months. Young children can change from the drinking whole milk to semi-skimmed milk after they are 2 years old, but only if they are eating a varied diet and growing well for their age. If your child is underweight, a dietitian or doctor may recommend they keep drinking whole milk. Fruit juices are a good sources of vitamins and minerals, but they are also high in sugars and acids which can damage teeth. If you choose to give your child fruit juices or smoothies, they should be diluted. Keep an eye on the amount of fruit juices and smoothies your child has. Make sure your child is not filling up on fruits. Underweight children who are drinking too much fluid and not eating enough do not consume enough calories and miss out on important nutrients. There are few steps you can take to increase a child's calorie intake until they reach a healthy weight while still providing a healthy diet. Make milk puddings. Make the soups with milk instead of water. Bulk up mashed potato by putting the milk or cheese in it. Children can learn their attitude towards food from the adults around them. The best way to help children have a lifetime of healthy eating is for them to see you eating a healthy diet and having a healthy attitude towards food. Make meal times family time. Sit around a table and enjoy the food you are eating. It should be a fun and happy part of the day. Do not associate food with rewards or love, as your child will learn to turn to food for comfort instead of why they are hungry. Introduce a wide variety of foods and taste early. If your child is a fussy eater and picky eater, introduce new foods gradually and in small portions. Offer lots of praise when they eat a new foods and ignore the negative responses to the food. Be patient. Some children needs to be afford new foods many times before they will eat them. Do not insist that a child eats everything on their plate or criticize them when they do not eat as much as you want. This turns mealtime into a negative experience for your child. Even if your child is underweight, it is very important that they are physically active. Physical activity helps them develop strong, healthy bones and muscles. It's an important part of the way they learn about themselves and the world. If the child is underweight, the amount of physical activity they should do may be different from other children. A nutritional assessment is typically conducted by a nutritionist or a health professional who is trained in nutrition. While a nutritional assessment might be conducted on patients who have been identified to be malnourished or at risk for malnourishment, anyone can visit a nutritionist to get an idea of their health status and how they might make better nutritional choices. When they understand the relationship between what they eat and how that impacts their health, both positively and negatively, they might be more likely to eat foods that are more nutritious and better for their health. Nutritional assessment can occur in a healthcare facility, in home-based care, or during support group meetings. A nutritional assessment will include taking anthropometric measurements, which include measuring height, weight, head circumferences, mid-upper arm circumferences, and skin fold thickness, and a biochemical, clinical, and dietary assessment, sometimes followed by an environmental assessment. An anthropometric assessment is the measurement of the size, weight, and properties of the body. The first step in an anthropometric measurement is usually to measure an individual's weight, which is strongly related to their health status. Losing weight unintentionally can be an indicator of poor health and an inability of the body to fight off infection. Weight gain can be indicative of poor nutritional practices or a side effect of a medication they might be taking. Having a low pre-pregnancy weight and inadequate weight gain during the pregnancies are indicator of growth problems and potential low birth weight for babies. Weight is measured using a scale. Newborns are weighted using balance beam scales or digital scales and are thought to have a low birth weight if they are less than 2500 grams. A low birth weight put babies at higher risk of physical and cognitive problems and nutrition-related chronic diseases, while all babies lose the weight immediately after birth. If they have not regained the weight within their first weeks of life, they are at risk of further complications. Pediatric anthropometric measurements are commonly used as indicator of growth and development for infants. These measurements are plotted against the standards World Health Organization charts to assess the growth of baby compared with national or international standards. The baby will be placed on a digital scale and the length will be measured with the baby laying down on the measuring equipment. Measure from the top of the head to the heel. The head circumference is taken with a measuring tape like the one in the. Then we will wrap the tape around the baby's head, above the eyebrow and ears. Waist circumference is measured to estimate fat distribution and the amount of the fat around the tummy area. A small measuring tape will be placed above the belly button. Skin fold thickness measurement assessment allow us to estimate the body fat in your baby. A caliper is used to measure the thickness of a fold of the baby's skin with its underlying layer of fat. The measurements are taken from the triceps, subscapular, and flanks. The measurement of the triceps skin fold is taken halfway between the top of the shoulders and the elbow. By 5 months, most babies are expected to have doubled their birth weight. For babies under the age of 6 months, the anthropometric measures include weight for length, weight for age, and head circumferences. The reason that babies are weighted so frequently after birth is that weight is an excellent indicator of nutritional health in infants. Adults and infants alike are measured with measuring tapes. An individual height is not particularly indicative of their health on its own. Combined with their weight can tell a lot about their particular health in terms of how much they weigh compared to how tall they are. In other words, taller people will typically weigh more than shorter people. So the properties of the measurements have to be taken into consideration. Weight for height is an index that is used to measure the nutritional health of infants up till the age of 5. A weight for height index compares a child weight to the weight of other children that are the same height and gender and have been identified in the WHO Child Growth Standard. Mid-upper arm circumferences is the measurement of the circumferences of the mid-upper arm at the midpoint between the tip of the shoulder and the tip of the elbow. Mid-upper arm circumferences measuring tape is used, which shows millimeter measurements. Mid-upper arm circumferences assessment measure the nutrient reserves in muscle and fat. The mid-upper arm circumferences assessment is measured independently to consider an individual's height or whether or not they are pregnant. Mid-upper arm circumferences assessment can also be used as an alternative to weight to height ratio, BMI for age measurements, or for those whose height and weight cannot be measured. Mid-upper arm circumferences should not be used for the infants under 6 months and should not be used as a tool for the people who have edema. A biochemical assessment looks at the levels of nutrients and chemicals present in the blood, urine, or stools. This testing is sent to the lab, after which the results can be used by healthcare professionals to find the information about individuals' health, any medical problems they have, or any medical problems they might be at risk of. Tests also measure the functions of vital organs, such as kidney and liver. Some examples of biochemical measures include hemoglobin, which looks at iron levels and indicates anemia; albumin level, which at low levels can indicate inflammation or infection; C-reactive proteins, which indicates potential infection and inflammation; white cell count, which is an indicator of an active immune system. If white cell count is high, then infection is present. Glycated hemoglobin indicates an average blood sugar level over a period of month, and sodium levels indicate hydration status and kidney functions. High sodium levels might indicate dehydration. Urea levels indicate kidney functions and may indicate possible dehydration. Calcium and phosphate levels are used to assess the risk of refeeding syndrome, which is a result of malnutrition. Magnesium levels that are low indicate gastrointestinal losses. Micronutrients will be impacted if inflammation or infection is present. A clinical assessment looks at any healthy problems or disease a person has that might impact their nutritional state or put them at risk of malnutrition. Disease may cause an increased need for energy, a reduced energy intake, or nutritional disease, such as cancer, heart failure, chronic obstructive pulmonary disease, gastrointestinal disorders such as liver, Crohn's disease, celiac disease, neurological conditions, stroke, motor neuron disease, Parkinson's disease, dementia, and multiple sclerosis, burns, surgery, or trauma, mental health conditions such as depression, anxiety, having diarrhea, constipation, reflux, bloating, nausea, vomiting, lethargy, feeling prematurely full, having trouble swallowing or experiencing lethargy are all symptoms of a disease that may decrease nutrient intake or increase nutritional losses. Certain medications might interfere with the absorption of nutrients, digestion, and metabolism. On the flip side, having nutritional deficiencies can also impact effectiveness of the medication. A clinical assessment also checks for signs of nutritional deficiencies such as bilateral pitting edema, hair loss, and changes in hair color. A bilateral pitting edema, also called a nutritional edema, is when there is swelling in both the feet or legs, caused by the buildup or fluid underneath the skin. This occurs when too much fluid moves from the blood vessels into the tissues or when not enough fluid moves from the tissues back into the blood vessels. A bilateral pitting edema can be easily identified by pushing a thumb into the swelling foot or legs and seeing if the indentation remains even after releasing the thumb. An essential part of the understanding nutritional health is knowing what food and fluids one is ingesting daily. A dietary assessment will provide information on how much food an individual eats, the quality of their food, any changes in appetite they have experienced, food allergies or intolerance, and the time where they did not eat enough during or after an illness. A dietary assessment can be conducted via several methods that include 24-hour recalls. A 24-hour recall is when a patient recalls all of the food and drink that they consume in the previous 24 hours. These can be conducted numerous times on different days to account for the differences in eating habits from day to day. Patient will recall what time they ate and the size of their portions. A food frequency questionnaire asks the patients about the quality of their food, how frequently they eat, and the size of their portions. While questionnaires are easy and inexpensive to administer, patients often underreport or do not accurately report what they eat, whether that is due to memory issues or wanting to withhold certain information. A food group questionnaire is different than the first two methods. That a healthcare professional will show the patient visuals of different types of food and food groups and ask them to identify if they ate any of that the day before. This way, rather than someone having to recall everything they ate on their own, their memory might be stimulated by showing them various food groups and options of what they might have eaten. Food security assessment is defined as having physical and economic access to enough food to meet the dietary requirements for a healthy life. This means that food must be made available to people and must exist in large enough quantities to feed the population. Food must also be made ready for consumption and utilization. If someone is struggling with food security, there are many support systems in place to help people have access to plentiful, healthy food. An environment assessment looks at an individual's ability to shop, cook, and feed themselves. It looks at budget, mobility, meal times, and family support. Particularly if nutrition is a concern, it will also look at appetite, how cutlery is used, and the general practices surrounding food. A nutritional assessment provides the patient and healthcare providers with an overall picture of their health and nutrition. The overall health of the body with regards to nutrition, dietary habits, and weight is an important factor in identifying any possible health risk or health problems, or preventing and treating the diseases. Weight loss or weight gain can be indicative of bigger health problems. Losing 10% of one's weight or more can lead to prolonged hospitalizations, and losing 35% of one's weight, if they are at a healthy weight to begin with, can lead to the death. Nutritional status also affects immune system and the way that the body responds to medical interventions. Some of the specific reasons that healthcare providers conduct nutritional assessment are to identify the risk of malnutrition and intervene before becoming malnourished, to identify the malnourished patients and refer them to treatment, to track the growth of a child, to identify medical issues that affect the body's ability to digest food and process nutrients, to identify habits, behaviors, or practices that might increase the risk of malnutrition or infection, to inform nutritional education, to help collect data for diagnostic purpose, to monitor any changes in nutritional status, to help create a nutritional plan and provide nutritional guidance. The results of the nutritional assessment help healthcare providers to create a plan for patients that may involve counseling, treatment, or referrals to food security or other social supports. For example, someone struggling with their eating habits might be referred to counseling, or someone struggling to have access to might be referred to a social worker or a food bank or other support service to prevent malnutrition. Conducting a nutritional assessment with someone who suffers from substance disorder will be useful in uncovering unhealthy eating patterns, potential health problems, and potential health risk. An individual's body and their health are integrated fully. So, when being treated for one problem, it is important to look at the body as a whole and how that one problem might have affected other parts. Identifying which nutrients are needed will allow healthcare providers to come up with a plan to help with the maintenance of healthy nutrient level, whether that includes changes to eating patterns, supplements, and vitamins. Nutritional guidance is often overlooked in the treatment of disorders, and recovery outcomes are improved with the nutritional therapy and a well-balanced diet. What we put into our body to nourish it really affects our health. Guidelines for healthy eating practices. Recommendation and guidelines for living a healthy life includes follow a healthy eating patterns across the lifespan. All foods and beverages choices matter. Choose a healthy eating patterns at an appropriate calorie level to help achieve and maintain a healthy body weight, support nutrient adequacy, and reduce the risk of chronic disease. Focus on variety, nutrient density, and amount to meet nutrient needs within calorie limits. Choose a variety of nutrient-dense food across and within all food groups in recommended amounts. Limit the calories from added sugar and saturated fats and reduce sodium intake. Consume an eating patterns low in added sugars, saturated fats, and sodium. Cut back on foods and beverages higher in these components to amount that fit within healthy eating patterns. Limit the calories from added sugar, saturated fats, and reduce sodium intake. Consume an eating pattern low in added sugar. Shift to healthier food and beverages choices. Choose nutrient-dense food and beverages across and within all food groups, in place of less healthy choices. Consider cultural and personal preferences to make these shifts easier to accomplish and maintain. Support healthy eating patterns for all. Everyone has a role in helping to create and support healthy eating patterns in multiple settings nationwide, from home to school, to work to communities. When it comes to recommendations on healthy eating patterns, the guidelines state a healthy eating pattern includes vegetables from all subgroups, dark greens, oranges, legumes, beans, and peas, fruits, grains, at least half being whole grains, fat-free or low-fat dairy, milk, yogurt, and cheese, proteins, seafoods, lean meats and poultry, eggs, legumes, nuts, seeds, and soy. There is no exact answer to how many calories one should consume every day. This number will depend on height, weight, and daily activity level. Adult women should eat between 1600 to 2400 calories a day, and adult men should eat between 2000 and 3000 calories per day. Lower end for sedentary individuals and higher end for very active individuals. If an individual needs to gain weight to maintain a healthy weight, they should increase their calorie intake. If they need to lose weight to maintain a healthy weight, they need to increase activity and decrease daily caloric intake. If the need to lose weight to maintain a healthy weight, they need to increase daily activity and decrease daily caloric intake. One should not engage in large amounts of weight loss or weight gain without speaking to a doctor or nutritionist first. While we have all heard someone talk about nutrition at some point in our lives, whether that was a parent, teacher, or a healthcare professional, with the amount of processed food on the shelf, it is no surprise that it is challenging to stick to the guidelines. The percentage of people who do not meet the recommended daily intake for the different food groups are 80% for vegetables, 80% for dairy, 75% for fruit, 70% for healthy oil, 40% for healthy grains, 40% for healthy proteins. The same people exceed the recommended daily intake of the food groups: 90% for sodium, 60% for saturated fats, 60% for refined sugar. To put it simply, people are not eating enough of the healthy foods they should eat and are overeating of foods that are unhealthy and dangerous in excess. Recommendations involved food groups and calories include: consume less than 10% of calories per day from added sugars. Consume less than 10% of calories per day from saturated fats. Consume less than 2300 mg of sodium per day. In terms of physical activity guidelines, children aged 6 to 17 should go at least 1 hour of physical activity a day, which should include aerobic exercises, high intensity 3 times a week, muscle strengthening 3 times a week, and bone strengthening exercises 3 times a week. Adults aged 17 to 64 should get at least 150 minutes of moderate intensity exercise a week or 75 minutes of high intensity exercise a week. Adults should strengthen train at least 2 times a week, and 300 minutes of exercise would be recommended for the best health results. Adults over the age of 65 should be as physical as possible while trying to maintaining 150 minutes of activity a week. The percentage of people in each age group who follow the physical activity guideline is 30% for ages 18 to 24, 20% for ages 25 to 44, 20% for ages 45 to 54, 10 to 15% for ages 65 to 74, 10% for ages 75 to 84, 5% for ages 85 and older.